increasing the speed of muscle fiber contraction, and also this, promote recovery. It's a big deal. Overtraining leads to injuries, so we want to make sure you're getting enough time to recover from training, that you're getting optimized nutrition for it. Injury prevention, you know, we are addressing the gender differences. We know that women tend to get higher incidence of ACL injuries, so how do we address that? How do we prevent that from occurring? Age makes a difference, anatomy plays a factor, flexibility and balance is as important as strength. A lot of football teams now are incorporating yoga, Pilates, stretch these guys because they're so inflexible. Trainers have different philosophies. So some trainers are really into high intensity exercises like CrossFit. That's not the best form of exercise to start off with. You build up to high intensity plyometric exercises, but a lot of people are getting into this routine in CrossFit because they're trying to lose weight. And you want to cross train, you want to combine yoga with weight training and running. You want to do swimming and cycling in addition to other weight bearing exercises. And like I said, you want to go for the high intensity plyometrics later when you're in shape and you're conditioned, not to start off with.
Can you talk more about the CrossFit issue, because it's so popular?
Yeah, it's very popular because it appeals to people who want to get in shape really quick and they want to drop weight really quick, and it does a good job of that. It's super high intensity, and there's also a camaraderie. So when you go to a CrossFit gym, you have a lot of people with the same goals, the same desires, and everybody's interested in helping each other out. However, the problem is that if your muscular structure, if your body is not ready for that, you will sustain an injury, just because it's too much. It overloads the muscles, it overloads the joints, and so it's something you really want to build up to gradually. You don't want to jump in initially and start doing 1,000,000 push-ups and pull-ups. And also the other thing with CrossFit is that their workout designs are not what an organized sports team would develop. So an organized sports team has sport-specific exercise programs. You know, working certain muscle groups specific to your exercise. You're working on developing the muscles and tone and flexibility related to that. CrossFit is really not sport-specific, so they throw in these what they call WODs, workout of the day, kind of random exercises. They get your heart rate up, they get a good burn, but they're not really specific to your body type and whatever sport it is you're trying to go for. Injuries, so we see minor ones, we see major ones. You know, it happens. So rest, address if there's anything we do to prevent further injury, change exercise routine if needed, cross-train. Major, well, then we have to pull you out. Maybe we need to do surgery, maybe put you in a cast, crutches, gradual recovery, rehab. So one of the big topics that we're dealing with now, sports concussions. It is becoming more and more common, and mostly because people are reporting it now. Before you got a ding or you got a hit, and it was just part of the game. You walked it off, you went back in the game, they gave you smelling salts, you woke up, you went back in. But now we're recognizing it more, and so reporting it more. In contact sports, it's the most common, so at least 10% of athletes in contact sports get them. After one concussion, the risk of the second does increase somewhat. This number is in debate right now, but it's usually in the initial period. So if you have a concussion, you need to rest, you need to recover, because your chance of getting another concussion from even a minor hit goes up. Eventually you recover completely and that goes away. We do know that younger athletes take longer to recover. When I say younger, like 10-year-olds. So 10-year-olds take longer to recover than a 16-year-old. Their brain is still developing at that age. They need to develop, and then they take an injury, so it takes even longer for them to recover. Despite all the awareness, even the recent death this past weekend of the high school football player, I think he was East Side, it still goes undiagnosed and unreported. So this was from this past season.
2-2. The right field, no, look out! Smoke-handed.
So even though you don't see him get hit too hard in the head, this is how they look when they're concussed on the field. They're kind of writhing around, they're wincing in pain, their eyes are closed, they're conscious. So most people don't lose consciousness when they get a concussion. They're awake like this. But this is pretty much how they look. And you wouldn't think of baseball as being a contact sport with concussions. So it does happen. It's not just a football injury.
The head trainer Rick Griffin.
All right, so what is a concussion? A mild traumatic brain injury caused by a bump or blow to the head. It makes the brain move back and forth. However, it's not necessarily a hit to the head. It can be hit to the body as well. And the technical definition is a complex pathophysiological event to the brain that is induced by trauma. So in order to sustain a concussion, you have to have been hit. You just can't be concussed without getting hit. And here's a picture in which the brain goes back and forth and rattles inside the skull. So it's a very closed, confined space. The brain has nowhere to go. So it hits back and forth, it gets bruised. There are lots of blood vessels in there. They get sheared, there can be bruising, there can be bleeding that occurs, there can be swelling. Like I said, it's just not a football thing. And this is just a bad idea. So, what's the big deal about this? Well, there's this law, the Zach Lystedt law, and this came from Washington. So, Washington was the first state to enact this law. It was named after Zach Lystedt. He was a football player. He played football, sustained a concussion, went back in, sustained another hit to the head.